Good afternoon, everyone. And welcome to today's update on COVID-19. Bienvenue à cette mise à jour sur le COVID-19. Speaking on behalf of the province today, the province's Chief Medical Officer, Dr. Jennifer Russell, the Premier Blaine Hicks, le médecin en chef de Dr. Jennifer Russell et le Premier ministre Blaine Hicks. Dr. Russell.
For the second time during the COVID-19 pandemic, I'm reporting to you on an outbreak of special care program. And I'm not shocked or surprised in the sense that the risk will never be zero during a pandemic. As you know, we do have increasing cases all around the world and in other parts of Canada. We have confirmed that 2 residents of the Manoir, Notre-Dame Manoir in Moncton, and 2 residential facilities have tested positive for COVID-19. These individuals are aged 70, 79, and 89. These 2 cases brings the total COVID-19 cases to date to 205. Pour la deuxième fois depuis le début de la pandémie de COVID-19, le gouvernement informé qu'il y a des gens dans les points spéciaux Nous avons confirmé que 2 personnes visitant au manoir Notre-Dame de Moncton, un établissement niveau 2, ont obtenu un résultat positif au dépistage de COVID-19. Ce n'est pas surprenant, c'est pas choquant parce que les nombres de cas tout autour de nous en Québec, Ontario, Maine, tout autour du Canada, les nombres de cas continuent à augmenter. Ces personnes sont âgées entre 70 et 79 ans et entre 80 et 89 ans respectivement. Ces 2 nouveaux cas portent à 205 le nombre de cas les 2 personnes ont été transférées vers un hôpital afin de limiter les risques de nouvelles contagions dans l'établissement, mais les préfectures se sont time during the COVID-19 We are deeply concerned for the nearly 100 residents and 56 employees. A mass testing team was on site earlier today at the manoir, and we have confirmed the testing of the manoir Notre-Dame and the way that those groups of learnings from the outbreak in the Campbellton region. So everything that was deployed on short notice has been done, and so we're very grateful that that is happening. We are aware that some staff members have reported potential symptoms of COVID-19. We are moving quickly to isolate those who may have become infected, and we will use all our resources available to us to slow the spread of this disease and protect the manoirs, residents, staff, and their families. Alors, les ressources qu'on a déployées hier soir et aujourd'hui, c'est vite fait, et c'est grâce à les apprentissages de l'éclosion à Campbellton. Alors, je suis vraiment fière de l'équipe qui sont là maintenant, et même aussi on avait une spécialiste qui a été là hier soir pour faire sûr que les protocoles sont suivis. The Provincial Rapid Outbreak Management Team, which we have an acronym which is PROMPT, for the Moncton region is on site at the manoir to focus on our resources on limiting this outbreak. And the PROMPT team is working with facility staff, extramural, public health, the regional health authorities, government departments, and regional services in responding to this outbreak. The PROMPT team works with the facility as it enacts its pandemic plan to provide rapid isolation and containment at the time of the first identified case, while ensuring quality resident-centered care and support to the staff. I do not have to remind anyone of the seriousness of this situation. All the measures that are in place right now with respect to public health, each one of them is not perfect, and that's why we have this layered approach in terms of border measures, self-isolation, testing, when you have symptoms, stay home, etc. So washing your hands and wearing your mask when you can't physically distance, they're all important, because individually not one of them can prevent the spread of COVID-19, but we need to do all of these things all of the time. Le Nouveau-Brunswick n'a enregistré que 2 décès depuis le début de la pandémie, ce dont nous sommes profondément reconnaissants. Or, comme vous le savez, ces 2 décès se sont produits dans un établissement résidentiel pour adultes à Atholville lors de l'éclosion survenue dans la région de Campbellton-Restigouche plus tôt cette année. Les aînés qui vivent dans des établissements résidentiels sont parmi les personnes les plus vulnérables aux effets de la COVID-19. Et comme j'ai dit en anglais, c'est chaque étape, chaque directive de santé publique ensemble qui va nous protéger du COVID-19. C'est pas une chose individuellement qui va nous protéger. Il faut faire toutes les choses ensemble. Les protections à nos frontières, les isolements de 14 jours, laver les mains, porter les masques, se faire tester quand vous avez des symptômes, rester à la maison quand vous avez des symptômes, laver les mains, la distanciation physique. Toutes ces choses ensemble nous protègent, pas seulement une chose. In tragedies we have seen too often in Nova Scotia, Quebec, Ontario, and elsewhere, the virus can have a devastating impact on residents in these facilities. This is a reminder to all New Brunswickers that the virus is still with us and presents an ongoing threat to the most vulnerable members of our society. And we will not be able to bring the risk to zero ever. Even if I told everybody to stay home, we would still not be able to change the fact that we're living in a global pandemic. And the last time we all had to stay home, that didn't work out so well for our mental health, our physical health. general society and our economy. So that's why everybody every single day has to make really good choices for themselves and for our province to stay in yellow and keep our children in school. We definitely must respect and observe the rules that will limit the spread. Les gestes simples, comme se laver les mains souvent, soigneusement, tousser et éternuer dans la manche, maintenir une distance de 2 mètres avec les autres, porter les masques lorsque c'est impossible, sont faciles à faire, mais ils sont aussi faciles à oublier. Over the months of the pandemic, it is easy to grow neglectful of these habits and to tire of performing them. We had a great summer with respect to low numbers, and I can't imagine that we can get any better than that in terms of what we have been able to achieve. But our continued success in limiting the spread of COVID-19 depends on your resolve to maintain these actions and follow the rules and assume that you and everyone else already has COVID. Behave that way. From what I have seen, the vast majority of New Brunswickers remain committed and determined to follow the guidelines that are slowing the spread of COVID-19, and I am proud of all New Brunswickers for doing that. But vigilance is required from all of us if we are able to prevent the surge in cases now being seen elsewhere in Canada. We are seeing that second wave. C'est vraiment important qu'on continue à suivre les protocoles et les directives de santé publique à cause des nombres de cas qu'on voit augmenter dans les autres régions du Canada, hors notre bulle atlantique, dans les États-Unis, etc. We are going into Thanksgiving weekend, and I want everyone to enjoy the holiday in the company of family and friends. Je veux cependant m'assurer que cette occasion festive ne soit pas assombrie par une tragédie. So really, having small gatherings outside, the physical distancing, masks, etc. are so very important. Nous pouvons tous profiter de l'action de grâce, mais nous devons être conscients des risques que pose la COVID-19 et nous devons prendre des mesures pour réduire ces risques. N'organisez que des petits rassemblements. Plus vous serez nombreux dans un petit espace, plus il sera facile pour le virus de se propager. We still have people who are traveling for essential reasons. Those people don't necessarily have to self-isolate. And so those people, we really need to make sure that we have caution around the choices that we make in terms of who we interact with and how. Maintain 2 meters of physical distance from others. When you can't do that, I strongly advise that you wear a mask or face covering. You can further reduce the risk of contagion by holding your event outdoors where it is easier to maintain physical distance. Please remember to wash your hands regularly and thoroughly and be cautious about handling food. Keep food preparation services clean and avoid sharing plates or cutlery. And please wash your masks regularly. If you're using a reusable mask, a fabric mask, please wash it regularly. Have several on hand so you can keep reusing only the ones that are clean and wash the other ones. Si vous ou quelqu'un de votre famille vous sentez malade, n'allez pas dans un rassemblement de l'Action de grâce. Les personnes les plus exposées aux risques liés à la COVID-19 ne doivent pas participer à de tels rassemblements. Les aînés, les personnes ayant certains problèmes médicaux et les personnes dont le système immunitaire est affaibli doivent être particulièrement prudents cette année. Those at greatest risk from COVID-19 should stay away from larger gatherings. The elderly, those with certain medical conditions, and those with compromised immune systems should be particularly cautious this year. And consider making your gathering virtual so that everyone can share in the holidays safely. We will all be together again in the months and years to come, but for now, we can't afford to take risks with a virus that can and will cause illness, suffering, and even death, because we can't see it. It is around us, and people can transmit the virus without having symptoms. And again, so if somebody has been traveling outside the bubble, even though they feel well, they look well, they can still transmit the virus. So we all need to take precautions. The virus is always seeking an opportunity to move to a new host. None of us can afford to take chances with COVID-19. Nous sommes tous à risque d'avoir le COVID-19 parce qu'on ne peut pas le voir. Vous faites sentir comme vous êtes en bonne santé, vous n'avez pas des symptômes, mais vous pouvez quand même le transmettre. Faites des choix tellement prudents pour l'Action de grâce, pour que ça déroule dans une manière très sécuritaire. Thank you very much. Merci.
Bonjour, good afternoon. While today's news is not welcome, it is not entirely unexpected. We knew that COVID-19 was not done with our province. Over the last few months and throughout the summer, we were able to keep the spread of the disease contained. Nous avons pu contenir la propagation de cette maladie parce que nous avons continué à prendre les mesures de précaution recommandées par la santé publique. En raison du nombre peu élevé de cas, certaines personnes se sont demandé pourquoi l'état d'urgence était toujours en place. Some wondered why all the precautions were still necessary. Today's announcement is why. This pandemic is far from over. I was here on Friday with Dr. Russell speaking about our concerns and the fact that this risk is literally once again on our doorsteps, impacting our neighbors in Quebec and Maine. Nous devrons continuer à suivre les recommandations de la santé publique. Ce qu'on demande à tout le monde est simple et nécessaire. Today is an important reminder of why we must continue to wash our hands, maintain physical distance from others, and wear a mask. And we need to stay home when we're ill. Today is also a reminder of why we're asking to keep the circle of people you interact with reasonably small. Keeping to smaller groups of family and friends means you are better able to contain the spread by limiting your number of close contacts. If someone does get sick, public health contact tracing can happen much quicker and further contain the spread of COVID-19 in our province. Please keep this in mind as you finalize your plans for Thanksgiving weekend. Les gens de Nouveau-Brunswick sont résilients. Nous prenons soin les uns des autres. Nous ferons ce qui est nécessaire pour protéger les membres de nos familles et de nos amis les plus vulnérables. Some of you have loved ones who are working or living in the Manoir Notre-Dame in Moncton. We understand your concerns, and we do not take them lightly. I wish to thank all of the frontline workers for stepping up and continuing to provide the care required by the residents of the Manoir. We appreciate your dedication to ensuring that residents and other staff at the facility are kept safe. As Dr. Russell has said, a mass testing team is now on site at the Manoir, and all residents and staff are being tested today. As well, we are moving quickly to isolate those who may have become infected. The Provincial Rapid Outbreak Management Team for the Moncton region will continue to be on site for as long as necessary to coordinate the response and limit the spread of the virus. All admissions and visit to Manoir Notre-Dame are currently on hold until further notice. All other facilities are to follow current public health guidelines under yellow phase unless otherwise directed by public health. As more information becomes available, we will continue to share it with you. En travaillant ensemble, nous avons réussi à limiter la propagation de la COVID-19 au Nouveau-Brunswick. Working together, we will continue to keep one another healthy and safe. Thank you. Merci.
Thank you, Dr. Russell. Thank you, Premier Higgs. Merci, Monsieur le Premier Ministre, Dr. Russell. We will now proceed with questions from the media. Each reporter will have one question, and you have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question. Vicky Hogarth, CHCO TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, you mentioned that officials who've been monitoring Atlantic bubble borders will be redeployed this week to monitor Quebec and U.S. borders. Can you elaborate on how this will work specifically at the U.S. border? What will officials be checking for? And will they be keeping records of each person's trip to help monitor for unnecessary travel?
The purpose of having additional resources at borders, be it the U.S. or Quebec border, was to assess the essential workers that are moving back and forth as part of the daily routine. so that we can maybe, start a spot check on frequent travelers, looking at where they're going in terms of where they're traveling into the U.S., and then where they're going when they come back here, so we can do some testing as they arrive or afterwards, or following up with what their routine is. So the idea was simply to provide a little more scrutiny into the thousands of let's say, essential workers or routine travel that does happen at our borders as part of everyday living, and which we have accepted for some time now. But because of the heightened activity in our bordering states and provinces, we're just saying this is a way for us to ramp that up with additional resources and additional scrutiny.
Thank you, Ms. Hogarth. Thank you, Premier. Andrew Watt, Telegraph Journal.
My question is for Dr. Russell. Dr. Russell, given that the protocols with visitations and admissions to nursing homes are so strict, how did this get in? Do you have any idea how it started?
Hi, Andrew. The most up-to-date information that I have right now is that the contact tracing is taking place, and obviously they're doing rapid testing to make sure that they capture all the potential cases at this point in time. So we don't have any more information on how it got there at this point in time.
Thank you, Mr. Watt. Travis Fortnum, Global News.
Hi there. My question is also about the U.S. border. I understand there's an outbreak at a Woodland pulp mill in Maine. Just wondering if we know if any of the affected workers are from New Brunswick.
So the status update on those people that work at the facility, I don't have any news that anybody has tested positive. So we are in very close contact with CDC Maine, and the public health regional team is working very closely on the ground at this point in time. But as of right now, there is no information that says that any of the Canadians at this point in time have tested positive.
Thank you, Doctor. Thank you, Mr. Fortnum. Near Urquhart, CBC.
Thank you. What can you tell us about the condition of the 2 residents who tested positive at the nursing home?
The most up-to-date information I have on those 2 cases is that they are stable currently.
Thank you, Ms. Urquhart. Thank you, Doctor. Michel Corriveau, Radio-Canada.
Oui, bonjour. Ma question s'adresse à Dr. Russell. Alors, Dr. Russell, j'aimerais savoir, est-ce qu'il va y avoir des mesures spéciales de mise en place dans la région de Moncton et des mesures particulières pour l'action de grâce?
À ce moment-ci, Michel, non, c'est vraiment les choses qui sont en place maintenant, c'est vraiment pour diriger l'éclosion à la résidence. Mais l'idée, c'est tout alentour du province, on veut que tous les gens seront très prudents la manière qui ont des rassemblements pour l'action de grâce. Alors, n'importe où que vous êtes dans la province du Nouveau-Brunswick, on aimerait que si vous pouvez célébrer en dehors, si vous pouvez garder les nombres de proches le plus bas possible et continuer à faire toutes les choses qu'on fait depuis le début de la pandémie, laver les mains, porter les masques, distanciation physique, etc.
Merci, M. Corriveau. Merci, Dr. Russell. Mathieu Roy, Como, l'Acadie Nouvelle.
Bonjour, ma question est pour le Dr. Russell. Dr. Russell, pouvez-vous nous dire si les 2 résidents avaient des contacts, les 2 résidents atteints au manoir avaient des contacts entre eux, s'ils vivaient dans la même aile du manoir, et donc si le virus est peut-être contenu dans une même chambre ou une même région du manoir, ou peut-être est plutôt un peu partout dans le foyer de soins spéciaux?
Alors, comme l'éclosion au nord du province qui avait inclus une résidence comme ceci, fur et à mesure qu'on a les détails, on va les partager, mais à ce moment-ci, on n'a pas beaucoup de détails. Ils font les dépistages, ils font les recherches sur les contacts étroits à ce moment-ci.
Merci, M. Roy. Jonathan McInnes, CTV News.
Hi. I'm just wondering, considering what happened, if there is any cause to more severely implement the mask
I think that all of the factors leading up to a decision in relation to mask, in relation to additional scrutiny around essential workers, and what precautions, added precautions we could take. What we're seeing, as I said, as we start to look around at different businesses and different public gatherings, how well are people adhering to the rules? How well are special care homes and nursing homes adhering to the rules? All of this in this situation well adds up to, I guess, decision point that would be made this week. We'll have a COVID cabinet committee meeting on Thursday, and we'll have more information on this particular situation at that time. And pending that meeting, I would suggest that changes would likely be forthcoming.
Thank you, Premier. Thank you, Mr. McInnes. Jean-Philippe Hugues, Radio-Canada.
Oui, ma question est pour Dr. Jennifer Russell. J'aimerais qu'on ait un peu de détails sur comment ça fonctionnait, les visites au manoir Notre-Dame. Est-ce que les résidents pouvaient entrer et sortir? Est-ce que les membres des familles pouvaient aussi entrer et sortir?
Nous, on avait lancé des directives avec le travail de groupe de pandémie pour donner des directions sur comment avoir des visitations en sécurité, mais chaque résidence individuellement faisait des décisions sur s'ils pouvaient suivre les directives et avoir des visiteurs. Alors, moi, j'ai pas de détails sur chaque résidence, mais nous, on avait donné des visites avant cette éclosion, la manière de faire des visites en sécurité, mais maintenant, toutes les visites sont annulées pour cette résidence.
Merci, Monsieur Hugues. Paige Woodard, Miramichi Leader.
Hello, my question is for Premier Higgs. I'm wondering, will the former Aboriginal Affairs Minister Jake Stewart face any discipline for working with opposition on the call for an inquiry into systemic racism? And what's your response on his plan to petition for that inquiry?
Oh, I think our MLA for the area certainly is free to express his views, which these views he's expressed before. So I don't think there are any surprises in that regard, and I would anticipate he'd continue to work for the community and the issues that he believes in. I mean, I expect every MLA to do that. So I'm not. There shouldn't be any surprise here. There isn't for me, and I would look forward to discussing, concerns as we go forward on how we can address the issues that I think we both share as opportunities for us.
Thank you, Premier. Thank you, Paige. Geneviève Normand, Radio-Canada.
Yes, my question is for the Premier. What does this mean for the borders? Like, how long do you expect the borders to remain closed, given that now we have this outbreak here in London?
Well, I don't see the borders opening anytime soon. And certainly talking about either our northern border with Quebec, any changes there. And in fact, we'll have to monitor very closely the situation in Quebec to decide whether the current bubble in that region is still safe and effective, because that is an immediate concern. Federally, I know that the date was pushed to October 21st, but I don't think there's, from my colleagues across the country, I don't see any push to open up the U.S. border anytime soon. So I would say that certainly in those border concerns, there's no immediate plans to open those borders.
Merci, Madame Normand. Thank you, Premier. Shane McGee, CBC News.
Given these cases at the nursing home and how Dr. Russell has said that some staff are showing potential symptoms, how is this going to affect staffing there and continuing care for the residents, the other 110 residents?
So the good news in this terrible situation is that we've had several learnings from the outbreak in the Campbellton area with respect to that residence. And so we have several things in place right now to make sure that everybody is looked after. EMP is on the ground, again, helping with the RHA and making sure that all of those things are being addressed.
Thank you, Mr. McGee. Erica Butler, CHMA Sackville.
Hi, Dr. Russell, you mentioned that essential workers are exempt from self-isolation protocols. Would there be essential workers in Moncton traveling outside the bubble and exempted from isolation?
I don't have the data on how many essential workers come and go every day or weekly or monthly, but there is no restriction for any of the places that they can go to. And these measures were put in place very early in the pandemic. So our mandatory order has all the exemptions listed, whether they're for essential travel or compassionate or medical reasons. So anybody who has an exemption can be anywhere in the province at any time. But certainly based on the information that we've been receiving over the last several weeks and what we know about the risks as they are increasing around us, those are things that we will be taking another look at with public safety as well as WorkSafe New Brunswick. Most people who are essential workers work with WorkSafe NB around work isolation procedures. So we're going to review those and see what kind of revisions that we can put into place that will increase our protective measures at this point in time.
Thank you, Ms. Butler. Thank you, Dr. Russell. Emma McPhee, Telegraph Journal.
Yes, my question is for the Premier. In July of 2019 and again in August of 2020, you said there would be a review of the property assessment of the Irving Oil Refinery and the pulp mills in the province. I'm told that the pulp and paper mill reinspection project was completed at the end of August. So I'm wondering, is this part of that promise review? And if so, what is going on with the refinery portion?
So the initial one that's completed has been through the mills, the pulp mills. The refinery one is not completed at this stage, but we will be taking that and doing a review on that as well.
Thank you, Ms. McPhee. Savannah Odd, Telegraph Journal.
Hi. Health Canada approved the first antigen rapid test yesterday. I'm wondering if New Brunswick will use this new test and when that might start in anticipation of the second wave. And if so, what settings, maybe Dr. Russell could speak to that, what settings it would be best used in?
So we've been having ongoing discussions with our federal partners and our chief medical officers of health and Health Canada and Dr. Tam, et cetera, for some time now. And then we have our testing strategy, and our working group with respect to the lab has been working closely on this as well. So as these plans come together, we'll be able to share more of that information, but certainly there is a prioritization and a plan for procurement, et cetera. The details are being finalized. So when we have more information on that, we can share that.
Thank you, Ms. Odd. Thank you, Dr. Isabelle Larose, Radio-Canada.
Oui, bonjour. Ma question est pour le premier ministre Higgs. Le nombre de cas est toujours en hausse du côté québécois de la baie des Chaleurs. J'aimerais savoir si vous continuez à maintenir la mini-bulle qui vient toujours avec les Tigouches et Pointe-à-la-Croix, et si vous seriez ouvert à ouvrir la bulle à d'autres municipalités de la Gaspésie, là, près de Pointe-à-la-Croix, qui ne sont pas affectées par le virus.
So we continue to monitor that and working with the officials in Quebec and working with our own public health. I don't foresee expanding that bubble in any way. And in fact, you know, we're looking at what are the alternatives that could be used. We're working with the community in terms of the number of school kids that are moving back and forth every day. So at this stage, I don't see an expansion in the works. A contraction is possible. So we are working very closely with the community to understand the risks and then what might be necessary to continue to mitigate those risks. And the further outbreaks in Quebec is certainly very, very concerning.
Merci, Madame Larose. Thank you, Premier. Eilish Boning, CTV.
Heather, my question is for Dr. Russell. What sort of visitation restrictions were in place at the manor before these cases were confirmed?
So we, with the pandemic task force, we had put out a memo to all facilities around what we would consider to be safe visitation practices, but we weren't involved really in the specific operationalization at each facility because each facility would have had its own way of dealing with that and limitations around the type of residents, the type of staff that could have that type of visitation. So I can't comment on that specific facility in terms of what they specifically out. We had released a memo several weeks ago, probably a couple of months ago now, on what all types of facilities could have in terms of visitation that could be done safely.
Thank you, Eilish. Clara from the Times and Transcript.
Hi, my question is for the Premier. Twice Premier Ford has told media in the last week during his own press conferences that you made offers to assist Ontario with testing. Is New Brunswick working on a plan to offer specific assistance related to COVID testing to the province of Ontario? If so, what is being offered? If not, why not? And is it at all related to a reagent shortage?
So yes, I had discussions with Premier Ford in relation to what we might be able to do to help in their testing, relieve some of their testing requirements. Their testing requirements are in the tens of thousands, and our capabilities are far short of that. But reagent is a concern. We have discussed that. Our officials have been talking with officials in Ontario. I did have a connection too by Minister LeBlanc in relation to what we might be able to do with for Quebec and Ontario. And so we have had those discussions internally back and forth. But I guess I just would stress the fact that, in relation to the thousands and thousands of tests that they're requiring, our capabilities are limited in that regard. But whatever capacity we have, certainly we will offer that to our colleagues, because we are working together in this, and reagent is an issue for us to ensure we continue to have to meet our needs, as well as what they could supply if we could do more testing. But I just make the point that our capabilities are far short of what demands they currently have to get caught up.
Thank you, Premier. Thank you, Clara. Voilà la fin de notre mise au jour. Merci beaucoup tout le monde. That concludes today's update. Thank you very much.